Hey, it's Melody. Welcome to a SANER Spin, episode 23. This week I am in Dearborn, Michigan, and I was here for the Muslim Mental Health Conference, which just wrapped up yesterday. And to say that it blew me away would be an understatement. It was amazing. The imams I met, the uh, mental health professionals that I met at this conference were extraordinary. The organizers did an amazing job. I really was blown away, like I said. I'm going to put a link to the Muslim Mental Health Conference website. This was the 7th annual Muslim Mental Health Conference. I didn't even know such a thing existed until this year, which tells you a lot. There's nothing really like it, and they are an amazing platform in terms of connecting you with other people interested in mental health who happen to be Muslim or are just interested in cultural competency in general, in the mental health profession, and also in terms of faith leaders. The organizers did an amazing job, especially Dr. Farah Abbasi at Michigan State University. I just keep saying amazing, but I'm not one to generally gush about stuff, but this is something that is definitely worth gushing about because I've never seen anything like it, and I've never had really an experience like this at a conference for sure. So yeah, I will link with some of that information down here. I also wanted to, I'm calling this part 2 from last week's episode about getting help for a loved one in a racist society with militarized police forces, aka the United States. In terms of being very careful, particularly if you're getting help for your loved one and your loved one happens to be a young black male in this country, and is in the middle of a mental health crisis. Turns out it can be very dangerous. And I want to say, and they can get shot and killed. And I pointed that out. And I also said you should call the cops. And I threw around police and cops sort of lightly. And a very smart psychiatrist I know put in a comment, you should call a medical emergency, which I was referring to in shorthand by the cops, which I shouldn't have. So I just wanted to clarify here that yes, of course you want to call a medical emergency. The reality is, and that's what I was referring to, that often in many localities, most localities, what will end up happening is even if you call a medical emergency, you explain it as a mental health crisis, the police are going to come anyway, and you're going to get transferred to the same 911 operator who's sending out the police. For example, my husband called a medical emergency when I was manic and psychotic and threatening a lot of things, and whenever there's any sort of threat of violence or danger to oneself or others involved, then they can send out the police. And in my case, they didn't even send out any medical help. There were no paramedics that were sent out. It was purely the police that came out based on how he described the situation, I think. But he called it a medical emergency, and that's what ended up happening. So I just want to make it clear, and often it's 911. So even as many resources as a community has, at 2 a.m, a lot of them are not available. But if you do have a mobile crisis team, especially, and that was my point last week, is to highlight crisis intervention teams, which are police officers who are trained to deal with mental health emergencies. So that if you're going to get a police officer anyway, which many times you are in terms of a mental health emergency, unfortunately, we don't have specifically trained psychiatrists to go at the drop of a hat to mental health emergencies. Usually that doesn't happen. I'm not sure of anywhere where that happens. And if you know of somewhere, please let me know. I'm sure there is somewhere. I just don't know of it. But the most common thing is that they end up sending out the police because effectively we've criminalized mental illness in this country, and we don't have a proper system to deal with mental health emergencies, let alone just mental health care in the first place before it becomes an emergency, which is ideally what you want to do, right? And so I wanted to make that clear because a very smart psychiatrist I know made that point in a comment, and it's worth definitely reading his comment and my response to it. But yeah, so that is part of getting help in this current society. You have to acknowledge institutionalized racism. even if the police officers that all come out to help your young black son in Atlanta are all black themselves. You need to recognize that police departments, a lot of institutions in this country are subject to institutionalized racism, so that even if the police officers aren't racist, and they're wonderful police officers. I have friends who are in law enforcement and have their hearts in it and really are doing it for the right reason, and I feel the vast majority of police officers for sure are there because they're interested in public service, and God bless them for doing what they do. They put their lives on the line every day for us, so I wouldn't want to minimize that at all, but I want to make it clear. And I think it's something that the world is beginning to see because the media is beginning to report on it more, not because it's happening more. I think it was happening anyway. It's just suddenly now we're reporting on it in a way that we weren't before. So, which thank God for that. And I think part of the reason that's happening is because people are able to film things when they happen. People were able at UVA to film Martise Johnson getting beat up on the sidewalk, beat bloody for no good reason. This really is generally a good reason to be beaten like that, but he did nothing, and is still, as far as I know, being charged, for example. So these cases of police brutality are not isolated, and often are the results not of necessarily the individual police officers involved all the time, but a system that is so deeply rooted in racism that it's hard to extricate individuals from that. So that said, I hope this has been helpful. If you have any other questions, please bring them forward, and I will again link to the information about the Muslim Mental Health Conference below. I hope that you'll visit it. It's an amazing platform for Muslim mental health professionals, for faith leaders of all varieties, anybody who's interested in providing more culturally competent care, particularly to Muslims, in this time, in this era where we face a lot of the same parallel kinds of stereotypes and misrepresentations in the media that people with mental illness face. And I, in my talk yesterday at this conference, was highlighting the parallels between the fighting Islamophobia and, for me personally, the fight against saneism, which has been you're dealing with a misrepresented minority that isn't so much of a minority, but is highly misrepresented and has a lot of negative associations tied to it based not on reality, highly associated with violence, despite the fact that people with mental illness are more than four times more likely to be victims of violent crimes than they are to be perpetrators. And when you control for substance abuse, really aren't much more likely to commit any violent crimes than the general population, the so-called general normal population. These parallels to what the misperceptions are about Muslims are striking. So I think there is room to work across fields there, especially in terms of activism. So this may be the longest SANER spin I've done in a long time, but I had a lot to talk about. Keep your questions coming, and I will keep trying to answer them. Okay, take care.